A very good afternoon to all. Welcome, and we are going to see the case note of Craig Hemsworth. You are a nurse in the general ward of King's Hospital, Cliff Rock. So your patient is Mr. Craig Hemsworth, who was brought to the emergency department, and then he was transferred to the ward. So this is the thing here. Now you are writing the letter to Dr. C. Blinn Johns. Address 68 Riverside Clinic, Newtown. So this is a discharge letter. You are writing the discharge letter to Craig Hemsworth's doctor. So he is the GP. I think the data is missing here. So he is the GP, Craigsworth doctor. So something is missing here. We do have Craigsworth GP, Dr. Savin John, 68 Riverside Clinic, Newtown. So this is what we are going to see. You're going to write this letter. So first of all, let's see the letter in detail. You can see the name of the patient, age. We don't need this address at present because GP knows it. Wife is Leah Hemsworth. Admission date 19/8/19. Discharge date 23. Yeah, this is important. He was waiting in the bus station. You can include fainting, unconscious, rushed to the emergency department, wife accompanied, jerky movements, you can, breathing stop, face float, incontinence. Oh, lengthy things. So we have a list of these things. So we need not include every data here. We need to see that significant data is to be addressed there. So be aware that if I go and include all the things like jerky movements for 2 minutes, breathing stop for 20 minutes, face turn blue, incontinence of urine, recovered consciousness after 2 minutes, no complaints of headache, all these things are, it cannot be included as the reason for presenting. I can write 2 sentences maximum. So include those 2 sentences, include these data into those 2 sentences. That's a maximum 1 to 2 sentences. That's the reason for presenting. That's it. Now assessment. You can see the assessment, a lot of assessments. Conscious, drowsy, bleeding from the tongue, bruise in the left arm, left knee, afebrile, disoriented. The vital parameters are given. Then central venous system, respiration, abdominal, no abnormal detention, no neck stiffness, no focal neurological signs. So neurological assessment is made. General examination is done. It's clear. Assessment, general examination plus neurological assessment is done. Now, what I can do, the diagnosis, tonic, clonic station, let it be there. So the past history, head injury from a car accident 2 months ago, GP knows, definitely he knows. No special treatment taken, GP knows. Occasional headache, GP knows. Blurred vision, GP knows. History of hypertension, GP knows. Tablet amlodipine, GP knows. Till the point he was admitted to the hospital, Everything GP does. Social history, we don't need to look there. Not at all. Family history. Father Parkinson disease, 2 children, 5 live separately. Now we don't need. Now investigations. Is there anything relevant? HB, WBZ, blood investigation done. So we have general assessment, neurological assessment, blood investigation, and 2 things relevant, 2 things, EEG and CT scan. EEG showed some focal epileptic variants present. CT scan showed subdural hematoma in the right occipital region. 2 things relevant there. Management. We have to see the management here is that patient moved to ICU, neuro consultation provided, mannitol, clopidogrel, all these things are important. So we need to focus on the medications which we are continuing after discharge. You can write mannitol, you can write all these things, but medications to be continued after discharge are this thing and this thing. One he was taking before for his blood pressure. Second, we started at hospital for the seizure. So we discontinued this, we discontinued this, we discontinued this, we discontinued this. So we have what we have done in hospital, complete rest, IO chart, what, ophthalmology consultation, all these things were done. Okay, now we have to say, if we want to write, I can say ophthalmology consultation and rest to eyes. Now, I can say what is the discharge plan. Discharge education, which included the wife, the patient to be monitored, write to patient GP. You are writing, I am writing to patient's GP. Continue phenytoin, 10 mg OD anticonvulsant. Follow up after 2 weeks. Review of anticonvulsant therapy. For that, you have to follow up. Use safety alert band. Avoid driving. Strenuous and activities you need to avoid. Regular sleep and healthy diet is needed. We need to include these things too in our letter. Let's see how to write this thing. We have seen the address, Steven Johns. Is it correct? One spelling mistake is there. Lynn, it is. Yeah. Okay. 16 Riverside Clinic, Newtown, 23 August. Today's date. Reference Craig Hemsworth, age 52. Dr. Johns, dear Dr. Johns, I'm writing to update you. Please don't write, I am writing to update only, writing to update you about Mr. Hemsworth. Some of the students, they write Hemsworth, who was under your care. No, it's not that much important. It's okay, we have understood that. Update you regarding or about. So I think it is regarding, it is better there. Regarding Mr. Hemsworth, who has been diagnosed with a TONIC clonic seizure. That's his diagnosis. He requires your follow-up consultations. Yeah, not one, many. And is being discharged today. Definitely, perfect. So who are you? Hemsworth. Who is Hemsworth? Your client. So it is update written. What's his diagnosis? Tonic clonic seizure. What he requires is that follow-up consultations. Mr. Hemsworth was brought to our emergency department. Okay. Following a fainting episode while waiting for bus. Now I have to write the date when it was 19th August 2019. So Hemsworth was brought to our emergency department following a fainting episode while waiting for bus on 19th August. So when is 19? 22, 21, 20, 19. 20, 21, 22, 23. 3 days ago. So I have calculated the date 3 days ago. 22 yesterday, day before yesterday, 21, 20. Yeah, 3 days ago. That's it. As per his wife's statement, who accompanied him, I need a comma, he had suggestive symptoms of seizures. I cannot agree to this particular statement. As per his wife's statement, yeah, who accompanied him? Wife accompanied him at the time of admission, sure. Suggestive symptoms of seizure. He had suggestive symptoms of seizure. Okay, of course, but how she knows whether he had suggestive symptoms of seizure? So I need to make a change there. As per his wife's statement, who accompanied him, suggestive symptoms of seizure suggestive symptoms of seizure were who accompanied him. He appeared to have suggestive symptoms of seizure. Okay, as per his wife's statement, who accompanied him, he appeared to have suggestive symptoms of seizure. Okay, now the problem is clear. So I cannot say that wife has suggested this thing, suggestive symptoms of, no, it is you have to decide whether it is suggestive symptoms of seizure or not. So it's clear. Later, he became conscious but disoriented and his tongue was bleeding. Okay, later when he was brought, he was like this. He became conscious but disoriented and his tongue was bleeding. Okay, fine. So up to this 1, 2, 3 sentences, clear. Further assessment included neurological studies. Yes, we have seen neurological studies there. Like you can see that there was neurological studies there. No, neurological sites, yeah. Yes, we had neurological studies there. Later, blood tests. We can see the blood test there. Yes, the blood test, HbWBZ. EEG and CT scan. EEG, CT scan. All these assessments were done. This assessment include neurological studies, blood tests, EEG, and CT scan. Now, what is there? What was the finding? Subdural hematoma was revealed on the CT scan, and focal epileptic variants were observed on his EEG. Based on these, the aforementioned diagnosis was confirmed. So based on these observations, subjective and objective observation, including the investigation studies, we have confirmed the aforementioned diagnosis. What is the aforementioned diagnosis? Here we don't have aforementioned diagnosis. Here we don't have, here we don't have. The aforementioned diagnosis is here. Okay. Now, if I have an aforementioned diagnosis here, it naturally becomes there. So please mind, you please don't write any diagnosis up to this point. If you have written, it becomes your aforementioned diagnosis. Okay. At our care, Mr. Hemsworth was commenced of fentanyl. That was injection. I'm not mentioning what injection, what was the dosage, nothing. Fentanyl, which should be continued along with his regular antihypertensive medication. So his regular antihypertensive medication was amlodipine. Doctor knows, so I am not mentioning the medicine name. GP knows what medication he is been taking before. So I'm not mentioning that particular name. Amlodipine is taken for 5 mg is taken for his regulation of blood pressure. I don't want to say because GP knows it. But GP does not know what is being commenced on fentanyl, and it should be continued along with his regular antibiotics medication. And GP has to know, oh, another person has come to the hospital and has seen the patient. That was ophthalmologist. He visited him, advised rest for his eyes. He was instructed to use safety band, avoid driving, and strenuous activities. We did it. Both Mr. and Mrs. Hemsworth were given discharge education. Okay, I have to say in addition there, to connect it better. In addition, both Mr. and Mrs. Hemsworth were given discharge education. Clear? So done. We have to move to the next area. It would be appreciated if you could accept Mr. Hemsworth back to your care and continue monitoring and management, focusing on rest and healthy diet. So continue the monitoring and management. When he is discharged back to your care, and you need to focus on rest and healthy diet. He's due for follow-up at the hospital in 2 weeks, within 2 weeks, for the review of anticonvulsive therapy. Yes, if you want to add one more sentence, because I do have enough space here. Now I do have 206 words here. If you want to add his treatment records are attached with this letter, you can add, because I have seen in many letters, you can write medication chart is added or treatment records are attached to this. Because you are writing to the GP, you can write it, no issues. But I think it is okay to write. If you have any further queries, you can contact me. That's enough. You are sincerely, ward nurse, King's Hospital, Cliff Rock. So we have come to the conclusion of this thing.